Hello, everybody. I'm Dr. Leslie Golden, and this is Weight and Gold, where we talk about the science and practice of weight healthcare, overweight, and obesity. And I am so excited that I have one of our amazing clinicians here with us today, Katie Zahour. Katie, do you want to tell everybody about a little bit about yourself, who you are, what you do?
Sure. I am originally from Wisconsin, so happy to be back practicing in Wisconsin. I've been a nurse practitioner for 17 years, so quite a bit of quite a bit of time in patient care. I've
Lots of
done things.
experience there. Yeah.
Yeah, I've done things in the field of urology. I've done bariatric surgery. Had patients in bariatric surgery. I have dipped in urology again, and then vascular was the practice I was at previously to this before moving back to be closer to family in Wisconsin. So happy to be
Amazing.
here. Yeah.
Amazing. And I always forget and then remember again that you had worked in bariatric surgery. So for those that's the surgery that is used to treat the weight condition. We've kind of rebranded it now, right? It's like metabolic and bariatric surgery. Some people may recognize it that way. And then now you're working with us with Weight and Gold and in obesity medicine. And how has it changed? What are some of the things that you've noticed that makes it different between when you practice it before to now?
Oh, yes. So when I was in bariatric surgery, I practiced at Vanderbilt, and it was mainly on the surgery side of things. And then I was there for 4.5 years. So shortly after I started, they opened their medical weight loss program while I was there. And none of the niche medications were prevalent at that time. So we were all just kind of learning, and the practices at that time also were very separate. There wasn't a lot of integration in them. It was like, okay, I helped the patients get to surgery and manage them through that. And then if weight regain started to happen a couple years down the road, they would get a referral to the medical side of things. So there wasn't a lot of we were in the same clinic, but not a lot of integration with the two specialties at that time, even though there was definitely curiosity on my part as to what that side of the practice looked like.
Yeah, that was kind of back when it was like the wild, wild west. Like we just used whatever medicine, like a lot of historically before the niche medications, we would just use medications that weren't necessarily intended directly for obesity treatment, right? We just noticed the side effects caused reduced weight, things like topiramate and phentermine, et cetera. And some of these we still do use in combination treatment or primary treatment, depending on the person. So Katie, what is a niche medicine? You mentioned that, and can you share a little bit more about what that is and what that means?
Sure. That is what was commonly referred to as the GLP-1, the medications like your Ozempic, Wegovy, Mounjaro, Zepbound. So those weren't as readily used at the time, or not nearly as popular back when I was.
Yeah.
Because I mean, this was like, oh gosh, I'm dating myself, but this was like 2010 through 2014. So 2000, yeah.
Yeah.
10 to 2014. So, yeah.
Yeah. And so I think part of that I think we'll hear that term more and more among society as we look at, because we're used to calling everything a GLP-1, right? But they're not all GLP-1s anymore. So I think the NUSH stands for this nutrient stimulating hormone therapies. And so the idea is any medication that is released that influences the hormones that are released by nutrients. So what in the world does that mean? So like I eat food because my body is sensing that nutrient, certain hormones are released. And those hormones can be like GLP, GIP, which is in the terzepatide medications. And then as we come forward with additional ones that are coming out, like amylin. So I love that you use that word, Noosh, because it's an opportunity for a lot of us to get used to it and to kind of expand our knowledge in this space. So Katie, so what do you wish more patients knew about weight health or obesity care in general?
Mainly that obesity is a chronic condition, and that the provider needs to, whoever they see, the provider needs to treat it as such, and that it's not just a one size fits all, that it's very individualized care based on the patient and what they've tried in the past, what they want to do in the future, kind of a thing. And that so much more than just eat less, move more. There's so many more factors involved in it than that, and that genetics play a huge role in the management of obesity care.
Yeah, I hear a lot of people say sometimes like your weight is actually more heritable than your height, which is hard to believe, right? Because a lot of us don't even think twice about like, well, of course you're tall, your parents are tall. But then when it's our weight, we're like, I don't know why I struggle with my weight. Sure, my whole family struggles with their weight, but that doesn't mean I should too. And do you hear that a lot in the conversations you have with your patients or even if you try to explain to them the science behind it, there's still this, no, yes, it should be different.
Correct. Oh yes. There's this like, I don't know if denial is the right word, but, or just like, I can't think of the right word right now, but yes, very much so. I experience that with patient care. Yes.
Yeah. I think it's one of those things we have to like unlearn so many things, right? Because we've been told by, so for many of us, our families, our healthcare workers, society, magazines, everything that like, hey, if you just tried harder, it would be different. And I love that the evidence is showing that that's not true.
Correct. Or that the medicines are a shortcut, which is absolutely not the case. Or to feel shame around it, wanting or having questions or curiosity about the medications. So, yes.
Mm-hmm. Mm-hmm. I mean, because what is wrong with saying, I wonder if that could help me? I know there's so many other conditions that you can think of, like if we look at depression or high blood pressure or ADD and things like that. And when you find out like, oh, there's something that could help me function and experience life better, I'd like to know more about that, right? Yes. Do you find that a lot of patients have experienced having to almost like audition to earn medical treatment for weight or even surgical treatment for weight? Kind of meaning, show me that you have tried before.
Yes.
Yeah.
Yes. I think that is very true. And I think that something that we do wonderfully here at Weight and Gold is that the compassion that we come in to every appointment, specifically new patient appointments, because it's hard enough to sometimes tackle this topic, and just coming at it with just coming at it with increased compassion when somebody walks in the room, and really trying to understand what they've been through and what they've tried. So yes.
Yeah, just really letting them share their story and unpack that. Because so many have faced kind of judgmental interactions or people that have preconceived ideas about why they're in the situation that they're in, and not exploring. Because I know I find if I just let the patient just unpack all of that, I learn so much about it helps me know like, okay, I know exactly where we need to start. And for a lot of people, starting is like helping them understand and helping them say, it's not my fault, and being the person to tell them it's not their fault.
Oh yeah, by stepping back and letting them talk, they answer a majority of my questions just in their story. They've done, it's.
Which is an incredible experience. I mean, how many of us actually get to go and have time with a clinician nowadays and actually say, wow, thanks for the time that you gave me. You actually listened.
And not feel rushed. Absolutely. Because it's a very emotional experience. It is very emotional.
Yeah. And I'm always proud for our patients that have taken that leap of faith to come in and share with us. I mean, I find that some of the patients that have come in, they've been thinking of coming in for months or years, and they've maybe rescheduled and how does that impact you? How do you feel when you realize that a patient has waited that long?
I feel honored to honestly be part of their journey. It really feels very good. And then to normalize them being here and what we can help them to accomplish and what we have to offer them. And then also just being realistic with them about expectations of the medications or just the journey in general. So that's kind of what I've experienced when they come in.
Yeah. I love that because I think that's so important because there's so much misinformation out there about what these medicines can do. This, like, I lost 150 pounds on this, so you should too. And it's just that next level of like, if you just try harder, like, oh, why you took the medicine and why didn't it fix all your problems? Well, we're all individuals, right? And not everybody's going to have that same experience.
Yes, very true.
And do you see, I think another opportunity for that is when our patients maybe aren't getting the results that they feel like they should, and are hesitant to come back. Thoughts on that?
Yes. One of the things that I try to cover, we cover a lot in the new patient appointment, but
so much.
But the expectation that plateaus are to be expected, and that they will come, to stay the course and to not get overly discouraged, because that absolutely can happen. And then utilizing our other resources as far as like our health coach and our amazing dietitians and all of that. So just knowing that it's a process.
Sometimes we just need that support through that plateau, because often in a plateau, we have to assess, like, have we developed new medical conditions that are getting in the way? Were there medical conditions that were not optimally treated? Maybe are we on medicine that's getting in the way? Do we just need additional medicine? Is it time for surgical intervention now? Have I developed a coping skill that I'm eating even though my hunger is very well controlled, right? So those are those opportunities where you really have to work with someone that knows how to tease that out and help you be a detective and figure that out for yourself. And I find that fun. I don't know. What do you think?
Completely agree. And I also love the ability to say, okay, I might not know the answer to this now, but I have an amazing team that I'm going to reach out to them and get their input on how to best move forward.
Yeah. Yeah, because I think especially with our dietitians, how people feel about dietitians is it's based on previous experiences, right? But I love ours because getting a nutritional history, getting the data and actually understanding someone's relationship with food is a very complex thing to do. And they really help us try to identify areas where we can help people be more and more successful. So.
Absolutely. Yes.
Yeah. Yes. Well, this has been an amazing conversation. I could talk to you all day about all of this, but I know you have patients that you need to take care of. Is there anything last comments about anything you wish you knew earlier in your career, or just anything you wish a patient or somebody listening would know?
I think that, I guess, probably just that it's a process, and that to not get overly discouraged, to know that we're here not to judge, but to just please come back and see us, just to know that, like, there are people out there that can support you, and that we treat the whole person. And so there's no one size fits all, that it's not just, like I mentioned earlier, that eat less, move more. There are so many more factors involved, and that we are not here to judge you. We just want to help you get to whatever goal you want to get to, whether that's a weight on the scale, or I had a patient tell me that they wanted a zip line. So whatever the goal might be, we are here to help you get there.
Awesome. That's a wonderful message to share. And I hope more people understand over time as we continue to get more and more involved and have more advances in this treatment. So, well, Katie, thank you. It's been great. And for those of you watching, if this has been helpful for you, please like and share so you don't miss any more valuable videos. Bye, everybody.
Bye.